Louis, stop.
Okay, go ahead, Rana, if you want to start.
Oh, okay. Welcome, everyone. I think we can put introductions. Well, we can go around with the six of us. If we get a crowd, we'll ask them to put introductions in the chat. So I'm Rana from New London, she, her, and New London. 4 years, I think it was almost exactly 4 years ago that New London passed its resolution. We've been doing different things since then, but I am really looking forward to getting back to that issue because budget problems, challenges continue at our municipal level. And just the gap between, the wealthy folks and the struggling people is exacerbated by our whole healthcare system. So I don't know, Holly, you can go next.
Sure. Hi, everybody. I'm Holly from Brantford. She, her pronouns. I believe that healthcare is a human right, and I will do everything in my power to try to make sure that everyone has access to healthcare. And we at Medicare for All fight for every person who is marginalized and fight for everyone to have as much access as possible, no matter how small of an increment we can get. Even though we do want it all, we still need to fight those small battles. So that's a little bit about me. And Pete, go ahead, please.
Hi, I'm Pete Cunningham, he, him, in Hamden, Connecticut. And yeah, what drives me here is just kind of the understanding that healthcare and health justice intersect with so many other areas. It's about labor rights and racial justice and sexual reproductive rights and gender rights and everything kind of runs through healthcare and access to healthcare, and ensuring free universal access to healthcare would benefit so many other areas of our society. So that's why I'm here. I don't know, Donna, if you want to introduce yourself.
Sure. I'm Donna Nicolino. I use she or they pronouns. I'm in Willimantic, Connecticut. And yeah, I agree with everything that Pete was saying about free universal healthcare being important to so many other areas and intersects with every other area of our lives. Yeah, it's the resolution in Wyndham, where Willimantic is located, we got passed, I think it was January 2021. And yeah, I think it's going to continue to be, kind of a long road, but I think it's really important, to keep pushing. And I was actually really encouraged recently to hear that our state is going to forgive medical debt, which is awesome. So it was nice to actually get some good news once in a while, that doesn't happen often. Yeah, so I guess that's it. And let's see, Karen?
Yeah, hi. I'm Karen Warinsky. I live in Woodstock, Connecticut, and I've been interested or concerned about this issue for many years. I've been active in this group, well, a little active for about 2 years. And in particular, I'm concerned about what's happening to local, small private hospitals. We have Day Kimball Hospital out here that's kind of under the gun. I know what happened in Rockville. And that issue concerns me. And I agreed with what Pete said about how this intersects. If you don't have health care, you don't have much else. So I just want, our country can do better. We can do better. And I think that was everybody, I guess.
Sarah, I would like to hear from Sarah, and then I'd like Brittany to go last, please.
Hi, everyone. My name is Sarah. I'm a nursing student at Southern Connecticut State University. I'm here today because this is something I'm very passionate about. As someone who has grown up in the system where there was no access to healthcare, I've always just been very interested in policies and would like to continue that forward once I graduate school as well.
I guess I should go. Hi, everyone. I'm Brittany. I use she, her pronouns and mix, not Ms. I am reaching you from Baltimore, Maryland tonight, which does not have snow on the ground. And I am the Medicare for All organizer at Public Citizen. And I worked with many of you on resolutions in the past. Some of the first activists I have worked with on this campaign are in this room. So always excited to spend some time with you all.
Thanks so much, Brittany. Would you like to, do you need to share your screen or anything like that?
I didn't prepare a presentation,
Okay,
but I did come with a bunch of things going on.
great.
In
Please
addition
go
to
right ahead.
resolutions, because it appears that Connecticut is actually quite an important state, not just for Medicare for All activism, but like Medicare activism right now. So the first thing is I wanted to ask if folks are familiar with the People's Action, the Care Over Cost campaign. So they, let me open up my notes again. So I want to make sure I have the insurance company right. Okay, so they are the Care Over Cost campaign that they're doing is kind of like they're talking about like denials and prior authorization and things like that, and case studies around these issues. And they're going to be doing a they're really going to be looking at, in the next few months, some of these big healthcare health insurance companies that are denying a lot of claims. And one of them is based in Hartford, Cigna. So I thought that you all would want to know about this in case this was something you'd like to be connected to. Oh, I think you're on mute.
Okay, so I don't think any of us have heard about this, and perhaps it was presented in a different way. But I don't think any of us knew about this campaign at all.
Yeah,
so yes, please connect us.
I just had a meeting with them a couple weeks ago, and we were going through their priorities, because for me, the purpose of resolutions for me is it's not just passing resolutions, it's also about getting people organizing, and I want people to keep organizing, right? And so there's like a lot of common ground here. And so they were like, yeah, and we're looking at Connecticut, but we don't really know a lot of people in Connecticut. And I was like, that's so funny. I have a meeting with people in Connecticut next Tuesday. So yeah, I mean, they can talk to you more about this. They're kind of like, because there's two sides outside of, in the Medicare for All movement, that's like outside of Medicare for All now, that things have progressed in talking about Medicare Advantage or privatized Medicare. So one side of it is the Care Over Cost campaign, where they're talking about these delays and denials and things like that. Just really like highlighting these corporations as the bad actors, and Connecticut's always going to have a role to play in that. And the other thing going on is I wasn't sure if you all have been looped in, maybe someone from PNHP might have looped you in on some of the stuff around Medicare Advantage recently. So
PNHP around in Connecticut has been doing quite a bit of trying to organize around Medicare for, Medicare Advantage programs, also in terms of things like denials of services. But I unfortunately missed their last meeting, so I can't really update on where they are right now.
Yeah, so I mean, I imagine what they talked about at their last meeting was there's like a couple of letters that are being put together. Where's my, got too many tabs. I can share my screen with this. Oh wait, no, it's disabled.
I just made you a co-host, so
Oh,
if
lovely.
you want to share your screen, you should be able to.
I'll just tell you because so you all have heard about like the letter that goes through Congress and people getting them off the letter, and that was something they did last year and then this year. So Pramila Jayapal, Schakowsky, and Rosa DeLauro are leading a letter alongside Warren about transparency and all this stuff with the Medicare Advantage program. So there's a few things going on. Is CT in this? Oh, it's not. But yeah, so one thing they're asking for is like reaching out to other electeds. I think what I heard from Mandy, who's now the organizer, the national organizer with PNHP, is just that they're finding DeLauro's office, like where I guess Blumenthal's the other senator, where he stands on this. So the steps on that for Connecticut folks are still, at the moment, I think it's kind of like go to a take action portal and watch this space. But yeah, but the more exciting, sort of more like organizing side of this at the moment is looking for the chat. Is there a chat? There it is. The more organizing stuff around it is the Care Over Cost campaign, and I'll introduce you all to the organizer in an email after that. And then there's of course, resolutions, which we continue to work on resolutions and use resolutions to pressure electeds on Medicare for All. We're at 130, and yeah, haven't done one in Connecticut in a little while, I think.
Yeah, I think Hamden was our last one, and that was in July of, been over a year, I think. I think that was the summer before last.
Is that 130 towns in Connecticut, or what is
nationwide, 130 towns and counties nationwide.
do we know how many in Connecticut have actually passed it? The resolution?
5, I think. New London, Wyndham, New Haven, Stamford, and Hamden.
Forgot about Stamford. That's right.
New London, Wyndham, Stamford,
New Haven and Hamden.
New Haven and what?
And Hamden.
And Hamden, right, and Hamden. Okay, no. Because I'm interested in this, well, we're all interested in it, It's an interesting concept to me, because we talk about what they do in Congress, but they do whatever they want in Congress, basically, So yeah, I feel like it's a very interesting concept to start, at a very local level and use that as pressure and leverage to actually, quote unquote, force, them in Washington to kind of like have no way out but to sign on to a Medicare for All bill. Now, of course, I realize that's very naively put, but I find it a very interesting process that really seems to me like it could be effective, really effective, but it takes a lot of work. I realize, believe me, I know. I was part of the New Haven process, so, and a little bit of the Hamden one before I somehow missed the rest of it, but yeah, it's a lot of work for sure. But seems interesting.
So, Brittany, I have a question. Did you say that Rosa DeLauro's office and Pramila Jayapal are actually leading this cause about transparency around Medicare Advantage plans?
That's right. Delaro has actually been pretty good on this, which is a surprising thing. And I know that you all have sort of seen her as like
Mhm.
a major target, right? And like this is, you know, this is also an opportunity to develop a positive relationship with her.
Yeah, so my thing is, you said you didn't have a position on where Senator Blumenthal is at?
On Medicare Advantage.
Oh, well, that's surprising
I
because
just
he is.
don't, I just haven't seen, I think they're still clarifying it.
Oh, okay.
Like he's not leading the letter and he hasn't signed the letter. So
Oh,
well, I mean the letter is just, I don't know if it's even been sent to offices. So
okay.
Mandy just told me that because they probably thought this is what they're going to ask you.
Okay.
Um,
Okay. Thank you, Brittany.
yeah.
I'm actually taking a lot of notes because this is very important because these Medicare Advantage plans are so gross and so disgusting, and they take advantage of the most vulnerable of our population.
Yeah.
And I have to tell you, um, it's very upsetting to me, and I'm not mentioning any names. But there is actually an organization that has trusted community members that they turn into licensed insurance agents and then put those trusted community members back into the low income, specifically Black and Brown communities. And it's okay for them to sell the Medicare Advantage plan. And I have been putting up a very big fight about these and specifically saying, I really don't care if you let them sell any other insurance plans on the world, even if Medicare Advantage plans are legal. I don't care. I want you to stop. So I'm still fighting this because they're being, what is it? Is Aetna being investigated for fraud, or is it Cigna, or both?
It's like musical chairs. It's always one of them.
Yeah. So that's my whole entire point. And I think it's like they're preying on people to bring in their trusted community members, then go back out and prey on their community members. And I just think it's unethical and it needs to stop. So I'm trying. And actually the first person to see it was Sivan. So kudos to her. And I definitely am still fighting that fight.
Oh. I just realized that there was something wrong in this document because it says that Elizabeth Warren is Connecticut. She's Massachusetts. So the other one is Chris Murphy. That's the other one they're still figuring out. Like they're going to ask Rosa about him.
Right.
I mean, like the thing has also been, you know, get them off the other letter. You know, there's going to be more letters from the other side need to be worked on.
I don't know how they get to continue to call these plans Medicare Advantage plans. I mean, that's so misleading. It really, to the average person, they're going to think they're signing on to Medicare. So I don't know how they continue to be allowed to do that. I mean, I know people are supposed to be informed, but that's a little too close, I think.
Well, that's the government name for the program. But I like that People's actually made a good point to me in a meeting where they were like, we prefer to call it Medicare privatization because like most people don't know what Medicare Advantage means. But if you say Medicare privatization, they understand that
Yeah.
without having to be like, oh, well, you could sign up for this, blah, blah, blah.
Mhm.
So, but yeah, it's
That's better.
like the thing that the points that the industry are going for is they're saying things like stability, choice, you know,
There's,
that kind of thing.
I watch Jeopardy, and they have commercials every day on Jeopardy. They're like 3 minutes long almost. Like they're incredibly long commercials for Medicare Advantage plans every single night on Jeopardy. It's nuts. They're like the longest TV commercials I've ever seen. It is every single night. Yeah, it's all about like, oh, yeah, prescription coverage and all this stuff. But it's, yeah, it makes me very mad every time I watch it.
Mhm. Yeah. Yikes.
Well, even the fact that the reimbursement rates are higher for Advantage sucks in some entities that really do know better. You know, I've been ranting for like 3 years that the Connecticut state retirees were all involuntarily shifted to Advantage plans, and the state does the copay. So, from the point of view of the consumer, it isn't a huge difference. But the way it works for the state is that the federal government gives them more money if they use an Advantage rather than traditional Medicare. So it's, and now there's a huge pool of state retirees, including me, that's in Medicare Advantage. The insurance company changes every year or so. It was United Healthcare, then it was Aetna, then it might have changed again. Whatever the controller gets the best deal out of. But it's just systemically, it's a bad way to do things. Rant over.
It actually hasn't been my experience that Medicare Advantage reimburses better. The one time I sort of got stuck because I thought somebody had regular Medicare, because she thought she had regular Medicare, actually billing a Medicare Advantage plan. They actually paid less than traditional Medicare, and there's no automatic crossover for Husky if people have Husky. So yeah, I actually found that it reimbursed a lot worse.
I don't think the providers do better off of it, but for some reason, the state of Connecticut does do better off of it.
Mm.
So even though maybe their gap insurance they provide, they might have to provide some things that they might not otherwise. I was told that the state saved a lot of money going to Advantage, and it's just, I don't know, I find it horrifying.
Is that for retired state employees?
Yes,
Yeah.
retired state employee. My husband is a tier 1. He worked for state of Connecticut for like a decade in the 80s. And yes, when we first signed up, it was, sign up for Medicare A and B, and the state provides the gap. And then we didn't do any paperwork. One year, Kevin Lembo said, oh, you're all going to be on United Healthcare now. You don't have to sign anything. You're just there.
So I'm a Yale retiree, and I believe they did the same thing. I mean, I don't know a lot about the process it took. All I know is now I'm on a Medicare Advantage plan with my Yale Health retiree health coverage. And I would imagine that it saved Yale money. And I don't know a whole hell of a lot about the rest of it. I really, it's very, oh my God, it's beyond, I don't know. It's hard to keep track of knowing what it's all about as it is. Anyway, aside from anything else, like what covers which and who pays for what. And oh my Lord, it's like you need a roadmap. And they don't provide you one. So you're in
Correct.
up a creek. You're up a creek trying to figure it out. But all I know is I noticed and I'm like, what? We have a Medicare Advantage plan? When did that happen? I don't even know when it did. Maybe it was always like that. I've not been retired for that long, so I don't know. But it seemed like a change to me, and I didn't know it happened either. I don't know if they have to inform you. I mean, I don't know, as long, I really don't, I don't know a lot about that.
So I'm not 100% certain which meeting I was in that I heard this. And I don't know if it was on the national level or the local level because they kind of all just merged for me right now. Oh, there's Brett Michelle. Maybe he's heard something. But I think there may be perhaps legislation coming up, whether it be this session, having to deal with that and allowing people to make their choice and not forcing them into a Medicare Advantage plan and allowing them to choose Medicare first and foremost, or allowing them to choose straight Medicare instead of Medicare Advantage. And I know that Phil Brewer was talking about this, and I'm not sure if it was on a national level or if it was going to be in the local level. I can't remember, and that's on me. My apologies. But I know it is being addressed, and I believe that Rhode Island did it, and I know that one other state did it besides New York. I think New York's failed by one vote or something, but I know that this has been passed in other states. So they are working on it. And I'm sorry, I'm looking through all my notebooks to find out where it is in my notes because I know someone talked
Yeah.
about it.
I heard about this same bill and I also can't remember if it was a federal, like I know that there've been state bills, but I can't remember if there's been a federal bill about this.
Yeah.
I mean, the state bills have further to go on this than the federal bills. I mean,
Brittany, you put some Google document links. Do you want me to share them or do you want to share them? So
yeah,
that
I can share this last one. So this is the newest one, which is the one I've been looking around for all this time. Finally found it. So this is the Be a Hero toolkit on the encouraging sign-ons to the Medicare Advantage reforms. Whoop. Now they've picked up like Senate targets that the Senate targets identified don't mention anyone from Connecticut, but I wouldn't let that hold you back. Yeah, so it's just like a quick action toolkit to get them on. And I expect that one of the things they would have talked about at this PNHP meeting that was earlier yesterday, they would have talked about setting up meetings. So if folks in this group are interested in attending meetings with the senators in Connecticut, like I would ask them, ask the PNHP-ACT.
That's
Okay.
great.
Thank you, Brittany.
Yeah, see what else is on here. Social media, tag these. Yeah, so that's the social media, and yeah, it's just sort of simple. There's also, I believe, the letter, if I click this and bring it up, I think that Jayapal's office is also seeking, oh, here's the letter. Jayapal's office is also seeking, the link to the letter is in the toolkit I shared. They're also seeking endorsements from community groups, just like she's on this letter, just like she sought endorsements on the Medicare for All bills. So that's something you should be able to do from her website. But yeah. I mean, are there any towns I mean, it sounds like everyone on here so far is in the area of a town that's already passed a resolution.
I am not, and my very, very conservative town, I'm sure would not be interested, even though it would be fiscally sound.
I don't think Brantford's that conservative, is it? Maybe I don't know.
Yeah, yes, Pete. I didn't think so either, but getting involved a little bit more in the weeds here, yeah, a little. So I can try, but I can try.
Is there a city, like a town or a city like in the vicinity that like makes more sense? Because when the first one with New London, like when Stefan got started, he didn't live there. He was just like, this one makes sense.
Right.
I think Middletown is
So
still the lowest hanging fruit we have.
agreed. Yeah,
True.
we can work on Middletown. And also Fairfield, because our late member Josh, he is from Fairfield, and we have been contacted by them recently, because they have taken over majority, and they would really like to see a Medicare for All resolution passed, and in Josh's honor.
Oh, the council?
Yes.
Oh,
So
that would be,
Josh was one of our executive team members here, one of our board members, and he passed away, I think, last year.
It's
And
good. Yeah, year and a half
yeah,
maybe.
yeah, I think so. And Josh had started doing all of the legwork to bring a resolution to Fairfield. And we had met with them, and he actually, I think, passed away the very next day or 2 days later. So they contacted us again recently and said they really wanted to meet with us and get started on doing a resolution in Josh's honor.
I didn't hear that.
Yeah.
that sounds
So
like
I
that's a
think,
much easier process than you had in
yeah,
some of these other cities.
100%.
New London was
Only-
pretty easy, but some like Hamden and New Haven and Stamford were very long slogs.
Mhm.
I
Yeah,
was gonna say, if you need help in Middletown, you might want to ask Brandon Chaffee. I would think he's in favor of the Medicare for all.
Okay.
He
Thank
might
you.
help navigate the local politics of Middletown.
Yeah, I know their mayor was a Sanders supporter as well. He's a younger guy. So I imagine he would be amenable as well.
I can't talk for the DCC.
And I know one of the council members, and he is also in support.
excellent, excellent. Yeah, that'd be
Yeah.
great.
Can I just ask how things are being envisioned? Like, because when I was involved, and this is now actually, wow, it's a couple or 3 years ago, prior to COVID, I guess, that big interloper into our consciousness. But, oh my gosh, what is this? Oh, it's Representative DeLauro. Bye-bye. Anyway, I was just wondering what the concept is with regard to like step two. It was like, get the resolution passed and sort of place that decision in front of one of the representatives.
Yeah,
But I mean,
well,
I understand, those representatives are representative of several towns, not just any one town. So were we like thinking of, once we get all their towns, that we would then place it in front of them, for whatever we decide to do? I mean, has the concept of the whole thing changed? It's been a while, so I don't know. I'm just curious what.
well, I remember with Rosa that she's resistant. Because I was there when they had there was a Medicare Advantage press event in like April, and it was an incredibly hot day.
It was
It was a very hot day. I remember that Delora was there, and then one of the other members of Congress was speaking. Maybe it was Frost, maybe it was Alejandro Frost, and they, talking about, Medicare Advantage, fighting that, but also how we need Medicare for all. And she just did. So like, I think in her case, it's a combination. I think one is yeah, if you can get more in her district, bring to her too. But I think also this letter is an opportunity to develop a positive relationship with her.
Yeah, that makes sense.
Um,
I mean, I don't know. It makes total sense. And
I
you
mean,
and
Doggett
would do
Doggett was sort of
something,
similar.
you know,
Lloyd Doggett was similar to her in that, he worked on it. He had his prescription drug negotiation bill for Medicare. This was years ago now, like 3 or 4 years ago, well before the pandemic. And he had not signed on to Medicare for all, and he eventually did. So I wouldn't say it's that, it's not winnable.
yeah, no, I don't mean it's not. I just mean that we would need to have a sort of a vision for how it should come together, and you know what I mean?
But like part of the purpose for the resolutions was to kind of create an organizing infrastructure at a local level, with the hope that groups like yours would find things to organize on after the resolution, like if you weren't passing other resolutions. And so we've been I mean, it's just me at the moment, because Melinda got a big promotion like 2 years ago now. But
Yeah, but this makes sense. That makes sense. Yeah.
so like I would like to be able to give like alternative things. That's why I checked in with People's Action because about their other campaign. It's just because it's good for these groups to keep organizing.
Mhm.
Yeah.
I
Like,
think one of our thoughts in New London was to get larger and larger constituencies lobbying for it, so that we're all individuals, but if you get a certain number of municipalities to also be pushing the issue on a citywide level. At the time, we kind of used the whole fracking waste ban in Connecticut. That had started out as a resolution campaign from town to town. And when about 50 of the 169 towns in Connecticut passed local bans, then the state legislature took it up.
Gotcha.
Medicare for All is a little more complicated because it's not enough to just deal with the state of Connecticut. Although, frankly, if the insurance capital of the world could make some progress, it might be influential nationwide. But it's just, a city can lobby better than a person. A state can lobby better than a city. And to gradually, enlarge your lobbying entity. So that's sort of what we felt like we were trying to start in New London.
Yeah.
part of what I've in my mind as well is that, local municipal legislators are the ones who tend to go on to be state legislators, who are the ones who end up going on to be federal legislators. People work from the bottom and go from there generally. So, if we get a few town councilors in Connecticut who have signed on to a Medicare for All resolution early in their careers, that could influence them later in their careers when they're in the House of Reps or in the Senate or something like that.
Yeah, I see. Okay, fair enough. Yeah, that makes sense too.
How old is Rosa?
Quite. I don't know exactly.
Well, I'm wondering if she's going to be retiring in a few years.
I would think she'd have to be sooner than later. But I imagine they're gonna.
Unfortunately, I don't know.
I mean, she's in her late
She's
70s at this
80.
point.
She is 80 years old.
Oh, she's 80 years old already? She is 80. She hit the
Yeah.
80. Uh-huh. Well, how old is Feinstein again?
Dead.
There's a there's a lot of members of Congress and senators resigning this year, like especially members of Congress. I think some of the redistricting and a combination of the redistricting and the just not accomplishing things. We're losing like 3 or 4 in Maryland?
So Brittany, I would just like to ask you if you could please send us at our email address, info@medicareforallct.org, anything that you feel like our members should sign on to, should know about, should possibly send letters for, or something like that. So then this way here, we can pass it on to our membership list. Well, actually, Pete can send it on to our membership list because he's the guru of that.
Okay.
So because we really want to keep everyone informed and engaged as best as we can. And I really wish I had known about this situation against Cigna more so, because
It's in development. It's in
okay.
development, so.
I was going to say, because I'm a part of a healthcare advocates group and there's a lot of different people involved in it. And we certainly will help with this as well. Because I bring up Medicare Advantage all the time in these meetings.
Awesome.
But yeah. Anything else you would like to bring up for us right now?
I mean, I think we covered most of it. Like, I'm here as a resource. It's just been great to see you all and reconnect, like I'm coming up on 5 years with this campaign. So yeah, it's and I'll connect you also with the People's Action Team.
Yes, please.
And yeah.
So I will tell you, thank you so much for all of your help and your guidance with all of the resolutions and the language in the resolutions and your toolkit that you guys have to do the resolutions with. And now that I'm actually, unfortunately, still a part of advocacy, I'm learning more about organizing, and you're correct. All these little steps help build organizing teams, and it just works. So your theory and your thoughts of process does work. So I appreciate everything that you have taught us and brought to us and continue to do so. So thank you very much.
Awesome. Thank you so much. All right, I'm gonna go watch The Bachelor now.
Oh, good for you.
Enjoy.
Good for you. Thank you.
Good to see you, Brittany. Thank you.
Take
Thank
care,
you.
Brittany.
Okay,
I noticed that
you know what?
Chuck
Good to
just
see- good to see
entered.
everybody.
We're not going to leave. So if you guys would just stick
Really?
around for a few
Yeah,
more
we're not-
minutes.
All right, maybe,
Yeah, I noticed
okay.
that Chuck from One Payer States just entered. And I go to those meetings quarterly, and they're working on lobbying on a different level. And if Chuck can you talk a little bit about what the One Payer States strategy is?
I didn't mean to be interrupting. I just wanted to
That's
swing by and
okay.
say hello.
That's
Yeah.
okay.
But I'm a Connecticut Yankee. I lived in Norwalk, so it's all good. Yeah, I had just written just a quick note in the chat. Just wanted to swing by and say hello. We're doing an event at the top of the hour called The Four Freedoms and the Fight for Healthcare Justice, and it's an effort to tap into why we fought the Second World War. It was freedom from fear, freedom from want, and then freedom of speech and freedom of worship. And these concepts are really, they date back to our originating founding documents, like liberty and justice for all, essentially, just wrapped in a nutshell. And then in 1948, the Universal Declaration of Human Rights. That was Eleanor Roosevelt. And that, of course, healthcare was one of the core universal rights, and every nation in the world agreed to that. That was in 1948. In many ways, it's a high water mark for humanity. And we're trying to figure out how to get back there, how to recoup that energy and that focus and that vision so that can help us help carry us forward. So some people call it, back to the future or something along those lines. I call it looking backward, which is the idea of visioning the world that we want, that we need, justice for all, visioning it and keeping that at the forefront of your vision, And then constantly asking yourselves, how did we get there? How did we win? What did that look like? And so that's the way to build strategy. I think Rana has been in the room a few times when we've talked about that. And to me, it's a very powerful approach. It relates to a book that was written back in 1887, actually called Looking Backward, by Edward Bellamy. Maybe you may have heard of it. I read it when I was a teenager. It was set in Boston, 1887, and through his fictitious character, who was a time traveler, he arrives in Boston in the year 2000, and everybody has healthcare. Everybody has, transportation and housing and childcare, and it's a peaceful world. And as a teenager, I fell in love with that. I thought that's what I wanted. That's what we need. So that helps me to think about how to build strategy and just to stay hopeful. I tend to stay away from positive, because positivism is sort of this reflexive, everything's great, but hopeful is a recognition of the reality that we face. We're up against the medical industrial complex, but I also visualize them falling on their own swords, right? Overreach. And we don't know when that tipping point's going to be, but we have to be ready to pounce on it when it comes. So right now we're working on the Sabuca legislation. You'll know about that ROCANA, HR 6270, and we need to get the Connecticut US rep signed on with ROCANA's bill. That's what I would, that's my big ask of you all tonight, is how can we do that?
I
And I
don't
was
think that
thinking-
will happen, Chuck, but we'll try if you need us to. It's just not going to happen. You know as well as we do that that's not going to happen. We've been trying for years
to get them
because it's not going to. Nope.
Well, you talk about the Medicare for All bill, like because the state-based bill actually has broader appeal across the political spectrum if you frame it right. So, I mean, we're going to get Republicans on the bill for what that's worth. We are very close to getting to the two Republicans in Oregon on the bill. We got Dean Phillips, who is a center-right Democrat from Minnesota running for president. We got him to sign on it, and he would never touch single payer. But the idea here is just to get to 218 votes. That's what we have to do, right? We have to pass the House. We have to pass the Senate. And right now, the national single payer bill is at 112 co-sponsors, and we've got to figure out a way to build that support in order to give states the opportunity then to model single payer at the state level. And then we go forward the way that Canada did back in the 1960s. So I don't take, it can't happen. I mean, I'm here in DC. I'm knocking on doors. I'm cold calling, and I'm talking to people and getting a conversation and listening to them and telling them, you have a seat at the table. If you think you have a better idea, bring it on. We all know in this room that only single payer can actually finance universal comprehensive healthcare for all. The other ideas are just, pie in the sky. But all we need is their vote to provide the enabling legislation for states to go forward with the universal healthcare model. So that's our theory of change, right? So we do need to get Congress to do something, and this should be an easy lift. Just give the states a chance. It's dysfunctional. It doesn't work in DC. Get the states doing something. Give them a chance. So that's my wrap.
I agree with you, and I think it's excellent. I will remain hopeful, Chuck. I really will. Hopeful is a good word.
Radical hope. Radical
and
hope.
Please, okay, radical hope. Please put the information in the chat because I honestly do not see it.
Yeah.
So please do put it in the chat.
Okay. Rhonda, do you have that access to that?
Oh, there it is. It just came in. But if there's a meeting or something, a link to register,
let me get the link
put
for
that
if you're
in there,
interested.
Chuck.
Yeah.
Yes, please.
Sure. Yeah.
And while Chuck
absolutely.
is putting the link in, I just wanted to mention that if new towns are thinking about resolutions, Medicare for All resolutions, or if old towns are thinking of reviving them, bringing them back, signing on to the state-based bill is something that we could add to resolution language, because that might appeal to different people because it's sort of a states' rights thing. And Connecticut, having not non-privatized Medicaid, actually, thinking about expanding Medicaid is different in Connecticut than it is in some other states. So once again, it's hard to be very optimistic, but I think there is cause to be somewhat hopeful.
So
Thank you so much.
Thank you.
bye, Chuck. So
Appreciate
on
it.
that note, you guys, listen, there are some very not so good things coming our way for this legislative session. So please be on the lookout for a lot of emails possibly coming quickly that will need some action this very short legislative session. Hopefully I'll learn how to do Action Network again better, so poor Pete doesn't have to put up with me. But but I will tell you, being in the healthcare advocacy group that I'm in, it does not look good for any kind of healthcare anything going to a good place. In fact, if you look at the governor's budget, he is cutting a lot of things. And not only that, but the governor is pushing for associated health plans, which are junk insurance plans. So we need to really get activated and be aware of a real lot of bad stuff that's coming on down our way this legislative session. And I am going to try my best.
What are those things called, Holly, again? What are those plans?
Associated health plans, AHPs, they say their initials are. It's a real problem, and they're just a real problem. I'm not really good about all the exact information on them, but it's really bad. When Sheldon Taubman says they're bad, they're bad. So I will tell you that there is a spreadsheet of things and topics that Connecticut Citizens Action Group and Universal Healthcare Foundation have put together, and they want to know whether as an organization we will support, oppose, do no action on, or just basically, not comment, so there's a few different options, and I would like to do a Google survey and send that around so that we can actually have a true democratic answer instead of just me, Ronna, Pete, and maybe a few other people chiming in. I really want everybody's input to say, yes, we as an organization will sign on to this, and we as a group will send written testimony. We'll go, if we can, to testify, because this is really important, guys. There are some really bad cuts coming our way, and it's good. And even though the governor says he is doing all this to reduce medical debt and get rid of it, the things that he's doing to cut Medicaid and to go to AHPs, that is not cool. So we have to really be careful, and we have to really be activated and stay apprised of all of these really bad bills that are going to come through. So I just wanted to pass that along, that it's really scary, the things that I'm hearing. There are some really good bills that are being put together, but we're also hearing that those good bills are going to be overturned and the language will be changed. And bills that were written into law last session and were supposed to go into effect this year are being rewritten because of
what?
Budget cuts.
Budget cuts.
Really? Yes, budget cuts. So yeah, I'm just telling you, beware of the words that come out of people's mouths, and then they sign legislation saying otherwise. That is my rant for the evening.
Well, if you can keep us posted on when to give testimony, because I didn't participate so much last year, but a few years ago, a lot of us were giving a lot of testimony at public hearings, and it made some difference. to really barrage, the legislators. Not all listen, but if you have a 5-hour or 6-hour or 10-hour hearing because there are so many people testifying, the legislators sitting at it kind of have to notice a little bit.
Yeah. So yes, I hope that would be the case, Rana, but as we saw Husky for Immigrants,
Yeah.
they did not listen.
And that
So
was
let me
12
yeah.
hours.
12 hours. So Michelle, can you tell me what the term is that we need to tell the governor that he needs to stop doing? Is it not, it's not the keeping the train on the tracks, but it's called what?
I don't know that expression.
Well, you know what I'm saying. You know, that to do a real moral and just budget, he has to do what and allow what to happen?
Oh, well, we need to allow the caps to be moved. Obviously, I mean, a bunch of legislators have been mentioning in the press all last week that we need to move the caps. And, I was asked by Dan Har if I was supporting the governor's budget. I was like, what? He's like, yes or no? I was like, no. It's like, anyway, so I'm not a big participant in the financial side of the state legislature, unfortunately. So I'm not super fluent with the finance side, but I definitely need to move the caps on many levels.
It's guardrails. There's guardrails in place. That's the terminology, guardrails. Yeah, something like that. Yeah. And in order to really do a just and moral budget, the guardrails have to be removed, and there has to be legislation in order to do that. And I know Senator Winfield says that he is going for that to happen in the press conference I was at last week at the LOB. So there may be hope, but we have to flood the governor here because he is our main blockade. So I'm just saying, we really have to pay attention, guys. This is very scary time when he can go back and change language that we worked over 2 years to get passed and fixed to cover people with disabilities and the elderly, and he just turns it around and changes it. So sorry, that's just a thing. People with disabilities and the elderly, you shouldn't mess with. Anyone shouldn't do that. It's unjust and immoral.
And it is a short session. So like you were saying earlier, the good bills are going to get, either watered down, or it's hard to think that they'll come out in a quote unquote progressive version of the bill, because clearly we know where the party's focus is generally. It's not on that. So
what is the session? Do we know the beginning and end? Just or
it already started last week and it ends May what?
6th or 7th or something like that.
Yeah, that's what I thought, May 6th or 7th. So I do have a list of subject matter, and I will send that. I will send a survey hopefully soon based on that, so we can decide. And then hopefully we'll be able to get on this really quickly, because CCAG, or Connecticut Citizens Action Group, is really pulling together a whole bunch of powerhouse organizations to fight back. And I don't think that the legislature is expecting this many groups to all be combined and to fight back.
Okay, good.
Another trick, Holly, that I see is missing with a lot of advocacy groups. When the advocacy groups manage to get meetings with the executive branch, they really should involve the legislators, because now you're putting Peter and Paul in the same room, and they can't play with the guys. They can't say one thing on one side and say something else on the other side.
Oh, good idea. Thank you. I'm writing that down.
That is a good idea.
Yeah, because the agency can tell you something that, like, they can say to a legislator, we never said that. right? And it's
That's
always what happens.
perfect.
I know with DEEP, DUAG, DPH, DCF, all of them.
You're finally home. Yeah.
Yep. Okay.
Oh,
No,
and I have an
that's
idea.
a perfect idea. No, perfect. Thank you.
And I have another idea, Polly.
Okay.
Medicare for all, like all the people that are under the umbrella of Medicare for All Connecticut, say they should get into the DCCs and DTCs, because then they would become members, then they could become delegates for the larger seats. That's where it matters.
I think
Anyway,
I think that was the strategy in Hamden, correct, Pete? The going through the DTCs, the DTC in
Yeah,
Hamden.
sorry, I was trying to find the unmute button. Yeah, that's
No,
right.
that's okay. Yeah, and I believe in Fairfield that we'll hopefully be doing very soon. That is with the DTC as well. So yeah, I think that was part of the strategy. But I thank you. No, definitely. Thank you, David. We appreciate that very much. And I'm sorry for going over time here, guys. If you get around, great. If not, we want to respect your time. Oh, cool. Everybody's staying.
Yeah.
But I would like to just give you an idea quickly of what's happening. There's alternatives to the junk insurance, and instead of addressing AHPs, let's go to what we already have and fix what we have instead of bringing in a junk insurance plan. There's cuts to Husky C. There's cuts to Husky A, which are really gross. The governor's prescription drug affordability bill, I think there's issues with. Addressing the root causes of medical debt instead of just forgiving. So there's strengthening hospital financial assistance policies and options and things like that. So there's a lot of things that, we want to change the income limit for covered Connecticut and things like that, and explain to people what covered Connecticut is and what it does and doesn't cover, as opposed to Medicaid or Husky. So there's a lot of things that people don't understand. Even some people in the executive leadership don't understand. They're like, oh no, you could just go to Covered Connecticut. Well, guess what? Covered Connecticut doesn't offer dental. It doesn't afford certain things to certain people. So it's really complicated. And thankfully, we have the experts in our advocacy group to straighten us out on these things. But it's really scary, guys. So please keep an eye out for our emails and hopefully our Google survey. And this way here, we can get an idea of which bills and policies you guys want to be a part of and which ones we just kind of want to stay out of and we will not sign on as an organization. Okay? If you guys have any questions? Okay, cool. Well, I really thank everybody for being here tonight. Stay warm. It is cold out there. And again, thank you all so much. And we'll be hopefully hearing from you all very soon.
Thank you all.
Thank you, guys.